Good morning, everyone. My name is David Paredes, and today I'll be presenting my research titled The Impact of Diabetes Self-Management Education on Glycemic Control and Patient Adherence. This presentation is part of my evidence-based research course at the University of Texas at El Paso. Thank you for joining me. Here's an overview of what we'll be covering in the presentation. We'll begin with an introduction to the topic, followed by a discussion on why this subject is relevant to the nursing practice. Then I'll present a case study that helped shape my PI-COT question. We'll explore the key components of that PI-COT question, discuss the search and research methods used, and examine the evidence through qualitative, quantitative, and systematic review findings. Finally, we'll review lab results, nursing implications, and wrap up with a conclusion and references. Type 2 diabetes mellitus is a global health issue affecting millions of people. If not properly managed, it can lead to severe complications like cardiovascular disease, kidney damage, and nerve damage. One proven way to improve health outcomes is through structured diabetes self-management education, or DSME. This type of education empowers patients to take control of their condition by teaching them how to manage medications, follow proper dietary plans, and engage in regular physical activity. Why this matters to nurses? Well, nurses are often the first line of support in diabetes care. We are in a unique position to educate patients and help them manage their condition. DSME helps prevent long-term complications, enhances patient adherence, and promotes better health outcomes. By incorporating DSME into our practice, we can reduce hospital readmissions and support patients in making sustainable lifestyle changes. Let me introduce you to Mr. JD, a 58-year-old male who was diagnosed with type 2 diabetes 5 years ago. Despite being prescribed oral hypoglycemics, his HbA1c remained at 9.2%, indicating poor glycemic control. He frequently missed his medication, had trouble sticking to a diet, and rarely exercised. Mr. JD also expressed confusion about how to manage his diabetes and reported feeling overwhelmed. Notably, he had never received any formal diabetes education. His case illustrates the critical need for a DSME program tailored to his individual lifestyle and learning preferences. My research question was developed using the PI-COT framework. It asks, among adult patients diagnosed with type 2 diabetes, how does the implementation of a structured diabetes self-management education program compared to standard diabetes care affect glycemic control and patient adherence within 6 months? Let's break down the key components of the PI-COT question. A population being adults with type 2 diabetes. An intervention being a structured diabetes self-management education program. A comparison. A standard diabetes care. An outcome of improved glycemic control and adherence, and a time frame of 6 months. The PI-COT question reframed simply is, in adults with type 2 diabetes, how does participating in a structured diabetes self-management education program compared to receiving standard care affect blood sugar control and patient adherence over a 6-month period? The search method to find relevant evidence. I searched databases including PubMed, CINAHL, Scopus, and Google Scholar. I applied filters such as peer-reviewed articles from the last 5 years, randomized controlled trials, and full-text availability. Keywords used included DSME, type 2 diabetes, glycemic control, and patient adherence. The research process. The research process began by interviewing the case study patient to understand his concerns. From that, the PICOT question was developed. I conducted a structured search on CINAHL and Medline for peer-reviewed studies, narrowing down to those published in the last 5 years. From those studies, I extracted relevant findings to inform the evidence-based solution. Operators and limiters. To refine my search, I used Boolean operators such as and, or, and not. My search focused on adults with type 2 diabetes mellitus who participated in DSME programs, compared to those who received standard care. The outcomes reviewed were HbA1c levels and treatment adherence. All studies reviewed supported the effectiveness of DSME in improving both glycemic control and treatment adherence. Programs that were patient-centered and culturally tailored showed the most success. Additionally, interdisciplinary care teams were key to achieving improved outcomes. Qualitative study. The qualitative study focused on interviews with patients who had completed DSME programs. Patients reported feeling more confident, less anxious, and better equipped to manage their diabetes. They emphasized the value of culturally relevant education and peer support. This highlights the importance of delivering DSME in a way that resonates personally with each patient. Furthermore, the emotional and psychological insight gained from this study reinforces the idea that DSME isn't just about data or metrics. It's about connecting with patients, connecting in a way that makes them feel empowered, understood, and capable of taking control of their lives. Nurses can use these insights to shape interventions that are not only educational, but also emotionally supportive. Quantitative study. The quantitative study was a randomized controlled trial which demonstrated a significant drop in HbA1c levels after 6 months of DSME. The program included medication management, dietary planning, glucose monitoring, and physical activity strategies. Patients who received DSME outperformed the control group in nearly every clinical outcome measured. The study also showed that patients who attended more frequent sessions experienced greater reductions in HbA1cs, suggesting a dose-response relationship. This tells us that consistency and follow-up are crucial elements of an effective DSME program. The findings give us measurable clinical validation that supports what we see anecdotally in practice. Systematic review and meta-analysis. This review evaluated over 20 studies on DSME and confirmed its effectiveness in reducing HbA1cs, improving medication adherence, and increasing patient self-efficacy. Programs with ongoing follow-up and individualized content had the most lasting impact. The evidence strongly supports integrating DSME into routine diabetes care. The review also emphasized that multidisciplinary involvement nurses, dietitians, pharmacists, and behavioral specialists led to more robust outcomes. Additionally, interventions that incorporated mobile health technologies or telehealth follow ups showed promising results, particularly in remote or underserved populations. This tells us that DSME can be flexible and scalable, making it even more relevant. Case study patient lab results. Let's revisit Mr. JD. After participating in a DSME program, his HbA1c dropped from 9.2% to 6.5%. His weight decreased from 215 to 198 pounds. The blood pressure improved from 145 over 90 to 130 over 80. The LDL cholesterol reduced from 145 to 115. These improvements demonstrate the measurable impact of DSME. Nursing implications. Nurses must tailor DSME programs to each patient's individual needs. It's important to address psychological barriers that may affect self-management. Coordinating care with interdisciplinary teams ensures holistic support, and ongoing monitoring is essential to reinforce behavioral change. In conclusion, DSME is a powerful intervention for managing type 2 diabetes. It helps reduce blood sugar levels, promotes adherence, and empowers patients to take control of their health. The most effective programs are those that are patient-centered, culturally sensitive, and supported by follow-up care. Nurses play a critical role in delivering these programs and driving better patient outcomes. Additionally, DSME is more than a short-term educational strategy. It is a long-term commitment to patient empowerment. As healthcare providers, we must continue to advocate for broader access to DSME programs, especially in underserved communities. By prioritizing this approach, we can reduce disparities in diabetes care and foster more equitable health outcomes. Investing in patient education is ultimately an investment in sustainable preventative care. The final slide lists all the sources referenced throughout the presentation, including key studies from peer-reviewed journals and American Diabetes Association. Full APA citations are provided in the presentation material.